part one, you were just getting involved in the dusty trades and the Oak Ridge studies.
Yeah, so maybe I'll talk about Oak Ridge,
Yeah.
because that's, I think, more interesting. So at the time, I felt I had an ethical dilemma, because I believed that I still believe there are ethical problems with the United States, my country, expending so much of its resources on weapons of mass destruction that indiscriminately kill everyone, which, when other countries use those means, we call them terrorists. And I really was concerned about entering into the service of that program, that project. And only later did I learn how that my concerns were actually more reasonable than I even had thought. Because actually I later was given a letter written by Clarence Lushbaugh. Dr. Lushbaugh was the medical director at Oak Ridge. And this letter was written in 1980, which was around the time that UNC entered into a contract with Oak Ridge Associated Universities, the one that supported me.
Mm-hmm.
And the letter that Dr. Lushbaugh wrote was to someone, I presume fairly high up at General Electric, at one of their reactor sites. And he was telling this General Electric person that it would be important to have good epidemiologic studies because workers were claiming that their diseases were caused by their occupational exposures. And furthermore, there were anti-nuclear activists who were threatening the industry. However, to save the day, Oak Ridge Associated Universities has a stable of epidemiologists and biostatisticians at the University of North Carolina that can achieve some kind of appearance of neutrality in this research that could be provided to GE. Anyway, that's the kind of thing I was concerned about, even though I didn't really know what was going on. But I ended up justifying to myself that I could be involved as long as I maintained a critical stance. And one of my interests actually was in the adequacy of the exposure records, the occupational exposure records, which were the foundation of these studies that are continuing to be done in an industry where at least one of the hazardous agents, ionizing radiation, which is actually many different agents, but that ionizing radiation was recognized even in the early 20th century as hazardous, and they had enough money to make measurements, at least for the more privileged workers. So I took on the Harvey's role as the PI of the study of workers at the Oak Ridge National Laboratory, known by its code name X10, the X10 facility. And this is a lab that was created in 1943 as part of the Manhattan Project. And our studies were basically based on the idea that there were these annual records of exposure that could be assembled over decades and then used to evaluate whether the readings on the radiation badges were related to the subsequent cancer mortality of the workers.
And this is these data were available since the 40s?
They began to collect at Oak Ridge.
Mm-hmm.
Oak Ridge developed some of the first dosimeters. So they evolved, of course, over
Sure.
time, and the
Yeah.
radiation monitoring programs evolved, but they had worker individual records. So this is not for the building or the room. This is actually a dosimeter that the worker would carry in a pocket
Mm-hmm.
or on a badge,
Mm-hmm.
and it would go everywhere in the plant with the worker, and then there would be a slot where the worker would place the dosimeter upon leaving work, and then actually early on these dosimeters were incorporated into the security badges because you had to have top security clearance
Mhm.
to enter the lab in the first place.
Mm-hmm.
Anyway, this got me into an area that was, on the one hand, kind of very esoteric, certainly not conceived of in terms of the ecology of society or some kind of grand interest in how human organization affects our health or something.
Not very sociological either.
Not it is,
Well, okay.
in a way,
Yeah.
but it wasn't conceived of.
But radiation.
Radiation has a physical exposure, very interesting topic, but one that turns out with kind of a sordid history of human experimentation and of research funded for the benefit of the employers in order to protect them from litigation and in order to protect the public relations interests of the nuclear weapons industry.
Mm-hmm.
What happened was I was given the responsibility of being the primary investigator on an update, meaning more recent follow-up information of a study that Harvey Checkaway had published 6 or 8 years earlier. And what happened was that we found that the badge readings were related to the cancer mortality of the workers, but there was a long latency.
Mm-hmm.
So this was something that had not really been evident in the earlier studies. You had to wait long enough.
Mm-hmm.
Well, we were not supposed to find this. And it was a huge problem at Oak Ridge. And I'll never forget Ed Fromm, wonderful statistician, who was working with us. I learned so much from Ed. Really very talented and one of those statisticians who communicates very well. Ed took me aside at a meeting of our group up in the Appalachian Mountains near Boone. We used to meet there because it was a more equal drive
Midway
with Oak
between
Ridge
Oak Ridge and
and UNC. And he said, "Steve, what are you going to do if you're called by the energy secretary and told that you can't report this?" Something like that. He was anticipating that there would be really an attempt to squash
Wow.
the study. And indeed, there was really an outcry with the advisory committee for the study when I presented the findings to them. And I was told by the chair of the advisory committee, very well-known scientist, that the purpose of our study was to show that what was already known was true, and that if we found something different, it must be a mistake. I mean, and this is a very reputable scientist. So I mean, this was a huge lesson for me. And of course, then I was called to report to the energy department and so on, and meetings before the study came out. When the study was eventually published, I was asked to change the title at one point because it had the word mortality in the title, and that would be somehow inflammatory. I mean, it was really a lesson for me. And what I realized following that was that if I felt that if I wanted to have an impact in public health, that maybe I shouldn't be studying these grand ideas about which I had no idea how to make a change, or like social inequality. I have no ability to do anything about that, and nor do I expect that the Federal Reserve Chair or the Secretary of Commerce or anyone else who might have such a problem was going to change anything economic because of the fact that there were people who were dying early. It doesn't work that way. They're representing the interests of the wealthy, and they profit from the current system. But working on this very narrow topic of ionizing radiation, so nobody had ever complained when I wrote a paper about social inequality.
Right.
Nobody ever had any problems.
Right.
But if it was a paper about ionizing radiation, it caused a huge uproar. Mm-hmm. And it was of interest to labor groups. Mm-hmm. And it's even today, to this day, of interest to workers who supposedly should be compensated under a congressional act that established a program to provide awards to nuclear weapons workers who contract cancers and other diseases as a result of their employment. Well, that led to my getting into contact with community groups, and I spent quite a few years working on studies of the meltdown in 1979
The 3 Mile
at
Island.
And that really affected my career. As I was told by one of the epidemiologists who had been involved earlier, why would you want to do this? This will be bad for your career. Well, it certainly was, in terms of a conventional assessment. Because I think I became ineligible for funding from organizations associated with the government that permits these activities and the corporations that profit from them. Mm-hmm. And, that's fine. I went on to get involved in other things. Although I'm still involved in that topic, and I still find it to be very interesting. So at that time, in the mid-90s, I also wanted to move into a research area closer to home, and it was in the mid-1990s that I met Cary Grant at Tillery, mm-hmm. and found out about the Concerned Citizens of Tillery, which is really a civil rights and social justice organization fighting for the descendants of slaves in eastern North Carolina, which is where it's part of the rural South that's home to something like 80 or 90% of rural African Americans. And I learned about one of the threats. I learned about a bunch of threats, and actually worked on several topics, including access to basic public health amenities. One of the first things I got involved in there was finding out that black residents have been excluded from town boundaries in order to prevent them from voting in city elections. But this also excluded them from things like water and sewer, mm-hmm. basic public health necessities. Mm-hmm. And we worked in a community where there was literally sewage running in the people's yards. And obviously, the kind of conditions that a lot of students come here to the School of Public Health thinking that would be true in a third world country, but not in the United States. Well, I'm sorry. it is a problem in the United States. And so that was one insight, and I also got involved in some other topics having to do with solid waste disposal and other types of activities that degrade the environment and human health, and are targeted for communities of color and low income. But the main topic that I've worked on in that arena is industrial animal production. And it turns out that in North Carolina, if you rank the counties of the entire country, we have all top 10 counties for the density of hogs. And they are adjacent to each other. And 3 of them are the top 3 counties in the nation for turkey production, which means that there's a region of the eastern part of the state that is literally covered over with animal waste. And the way the waste is handled is clearly a threat to people's health. Not to mention human dignity, that because the conditions people live in are horrendous. Having to, children going to school smelling like hog waste, and people not being able to open their doors and windows or tend their gardens or hang out their laundry. Just basic activities that, especially if you're low income and you don't have air conditioning or a dryer, this is part of daily life. Or you have a garden where you raise your food. The air pollutants. And then there are also water pollutants. So we got involved in a series of studies, and I think have made a real contribution because we had a partnership. I couldn't go to these communities and conduct research because I'm white and I'm from the university, and people would not trust me. But I could go along with my partners in the community groups that we worked with, who were African American, and they would introduce me, and we would talk. And through that route, we were able to do a number of studies, including one in which we actually got enough funding to bring a mobile monitoring trailer to capture particles and to measure the concentrations of hydrogen sulfide, a toxic gas that's produced by the anaerobic decomposition of animal waste. And so we were able to conduct what some people call a panel study, a repeated measure study, in which rather than comparing an exposed population to an unexposed population, we compared exposed person time to unexposed person time, or literally in a dose-response mode, none, low, medium, high, etc., exposure over time. So each person in the study serves as her or his own control. And therefore, all of the characteristics that are typically most concerned as confounders, such as medical history or job or nutritional intake, over the few weeks of the study, this was all constant for a person. It couldn't possibly confound anything.
So you were able to monitor exposure at the person level?
We were able to monitor exposure actually at the neighborhood level, because we didn't have enough equipment, or there wasn't adequate technology for individual monitors, like a badge, like the workers in the nuclear facilities. So what we did was we would recruit a group of people in the same neighborhood who live close by to one another. And then we would place the air monitor in a central location. So to the extent possible, it would be roughly a good representation of what they were all exposed to. And then twice a day, at an a time agreed upon by each person before the study started, they would sit outside on their porch for 10 minutes to be exposed to the ambient air. And they would return indoor to perform a few maneuvers, including measuring their lung function, their blood pressure, and filling out a diary about symptoms. And so this became the basis of our study, but interestingly, it was also perfect for the community organizers, because they got to work not just with people one at a time, but with groups of people. And they became knowledgeable about research design, about the industrial animal production that's come to their area, about the kinds of pollutants that were there, and about, very importantly, about environmental injustice.
Mm-hmm.
And so I think we, even if all the hard drives with all the data for that study had been destroyed, there would have still been an important public health outcome, which
Mm-hmm.
was that people became involved, more involved in action to protect the health of their communities. So that was an important part of the work.
And was this one that the North Carolina Port Council wanted to know the locations of the monitors?
Oh, no, that was actually an earlier study in which the university declined to protect the confidentiality of research subjects.
I thought they decided in the end to do it.
Well, what happened was that the Port Council, which is an industry trade group, sent a letter to me with copies to the university officials, and actually also to the state Department of Health and Human Services, which had provided some of our funding, requesting all the addresses and names and locations of all the people in the study. And the first thing that happened was the senior counsel for the university, and who was also the associate chancellor, instructed me to turn over all the documents immediately. And I said I couldn't do that. And I was subsequently told by an administrator that, and this was not a threat, this was a heads up. If you are instructed by the senior counsel to turn over the documents and you refuse, the university will have you arrested for theft of state property. So I learned that our research records don't belong to us. They belong to our employer. And if I were to insist upon protecting them when instructed to turn them over, I would be a thief. So at that time, I retained my own counsel to fight against my employer. And we were able to make a deal. So we did turn over the records, but before we turned them over, we redacted them to avoid revealing the locations, as well as anything personal identifier like the maps and so on. But even the physical location, the towns, the areas where the study was done, because if you knew that someone, the occupation was a nurse, they lived in a household with 3 other people, they were aged 35 to 39, etc. There's only one person like that in a rural area. So the deductive disclosure would have destroyed the protection of the study participants. So
Which the university had guaranteed to maintain
which the
with
IRB, yeah, which is another topic that's sad. But so we did give over the records, and I actually to this day remain regretful that I didn't resist more.
Who was your attorney? Is that something that's useful to share?
My attorney was a man named George Miller from Durham.
And now, I thought that actually the dean wrote a letter in support of your situation. Dean Roper? I know we talked to Alan Cross. I know talking to Alan Cross about your situation. And
right. I talked with numerous people. But I mostly the advice from senior faculty here was to do what I was told.
But there was some issue, I think, that the Port Council wrote back and said, yeah, but we want
Yeah.
the locations.
Yes, well, they did, and we didn't give them up.
And that was the one where you got some support.
I think I did get some, I guess I would consider lukewarm support.
Well, I mean, the dean wrote a letter to Susan Eringhouse, I think.
Could have been. I don't remember that letter. I can look for it. It should be in my files
if you think of it.
That
The reason I remember it
Mhm.
is that I actually when I spoke with Alan Cross, I said, my colleague is in this situation,
Yeah.
this is terrible.
Yeah.
And he said, well, the dean would certainly not want that to happen, because
Right.
how can we have research
Right.
from your people
Right.
turn over their
Right.
records?
So
like
it
that.
would have been an
So-
interesting opportunity for the university to go to the state legislature to settle a structural problem with the state public records statute, in which currently, as written, means that state universities are not able to protect confidentiality in the way the private universities are. So it puts us at a disadvantage.
Mhm.
And it would have been an opportunity to clarify the legislation to protect research participants,
Mhm.
but that wasn't done.
But the university said that the privacy could be protected, as I understand.
The university did act after I got my attorney involved, but only after,
But I mean,
to allow us to redact the documents
mhm. And to resist the further
and to
request.
resist further requests. Yes.
No, I'm not trying to indicate that you didn't have to carry the ball first part, but then at the end.
there was, of course, I can tell you the most supportive person was the chair of the IRB,
Mhm.
who was horrified.
Who was that?
That was Linda Adair.
Uh-huh.
She was horrified by this.
Mhm.
But she had no legal standing to intervene,
Mhm.
because it was a matter of the university council's office.
Right.
And so that was different, though, than this study.
You told me that you would go to jail if it came to that, and I'm glad you didn't.
I'm glad I didn't as well.
So I realize I'm keeping you over the time that I promised. So do you want to talk about your course, the seminar, and your philosophy, your critique?
Well, I could very
in terms of what
briefly,
time we have?
I could tell you.
Well, you watch the clock, and
I'll
when you have
watch
to
the
go,
clock.
we'll stop.
For the record,
Mm-hmm.
and this is again, I'm always trying out my argument.
This is just between you and me, right?
Just between you and
Camera.
me. Because you have to test yourself, right? So one of the ideas from philosophy of science that I've incorporated into the class, and that has helped me to understand our discipline, I believe,
Mhm.
is the concept of reification,
Mhm.
which is essentially the idea that a model is real. So it's the forgetting that we have a model,
Mhm.
and then that has consequences. So I think perhaps the most powerful model that drives our field is the model of the experiment, in which we can, well, if everybody were the same as everybody else, we wouldn't have to randomize.
Mhm.
Randomization is required because there's heterogeneity.
Mhm.
But, okay, so because there is, then we randomize. And we expose one group, and we don't expose the other group, and everything else is held constant. And it's a wonderful approach to understanding certain questions. However, what we have done is we have come to believe that that's the way nature works. That things in nature vary one at a time. And they don't.
Mhm.
And furthermore, another consequence is that we have come to see the population as an N. It has no other attributes. Because in the experiment, there's no relationship between the exposed and the unexposed, or the diseased and the not diseased. They've been randomized. Why are people exposed? It's not interesting because the investigator exposed them. Whereas in nature, there's very important patterns of exposure, and it has to do with the organization of the population. So the population isn't just an N. It has dynamics, and we have relationships with other populations. And some of them are microbial, and some of them are, other life forms. And then, of course, there's the physical and chemical world. And those relationships are full of feedback loops and points of leverage and so on that are nonlinear. And we're really poor we don't have methods. To the extent that our methods are driven by the model of the experiment, we really have a tough time when the exposed are related to the unexposed. Like, we're unexposed because someone else is exposed. And if that's an important part of the dynamics of human health, we need some other way to understand it. And so I've become interested in this problem. Well, I think it's a problem that epidemiology has become, in many people's eyes, defined as a toolbox, as a method, based on the experiment, that can be applied to anything. And to me, that we're reneging our responsibility as a scientific discipline, because scientific disciplines have areas of inquiry. They're aspects of nature that they're about. They're not all about all aspects of nature. There's some part of nature that they're concerned with. And the part of nature that originally got me interested in epidemiology was public health. So I think it's alienated us.
That is still the definition of epidemiology, isn't it?
Well, whose definition?
The standard textbook one about the study of the distribution.
There are lots of definitions of epidemiology. And the one that I find to be the most honest, I can't quote it in its entirety.
Most honest or most?
The most honest about what we really do today.
You mean occurrence research?
Yes, occurrence research in medicine. That's Mietten's definition. And it's so devoid of content that I think it really characterizes this notion that it's a tool, not a substantive area.
But you wouldn't give away the original definition, would you? I mean, one can say that's a description of what's going on now, or the dominant theme, but let's not give away the primary definition that we brought from McMahon and Pugh, for example, or John Last.
The distribution and determinants of disease in population.
Exactly. And
and I'm okay with that. And in control, yes, as part of, which is dropped by many modern textbooks. But even the control part, I have a problem with, because it goes back to the idea of the managerial class, which is responsible for engineering the whole society. And my own belief is that public health ends are better served by more democratic forms in which people have resources and education and opportunities to be involved in determining the fate of their own lives and their communities. And I feel that historically public health, going back to the arguments about why the decline of coronary heart disease or changes in any public health, any kinds of public health, that really what's been the missing link investigation of public health is the role of popular movements. So in this country, the abolition movement, the movement against child labor, the women's movement, which ended in women getting the right to vote, or it's still ongoing, the civil rights movement, other human rights movements for groups that have, many groups that are discriminated against on various grounds. I think all of these movements are about the betterment of the human condition, and that's a better model for public health than, say, making sure that everybody takes their drugs every day. Or that they are told how to behave, what to eat, what not to eat, what to smoke, what not to smoke, all those things. I think, actually, Nancy Milio's idea, someone else who I'm sure you've run across.
Interviewed her, actually, Bill Jenkins.
Nancy's idea that the basis of public health is creating environments where it's easy for people to stay healthy. That's profound. And I think that's correct. And I don't think that the engineers and the people who profit from low wages and contaminated neighborhoods and so on will make those changes. I think they come about generally because the people who are suffering from the current conditions say this is not okay, and they organize to change their communities.
So we have to redesign epidemiology. So
yes, and I think our current form, which relates to the experiment, is ultimately best suited for profit. So it works great for selling drugs. It works great for interventions that don't